If you just use these tools and you dig around for 5 or 10 minutes and you do nothing else afterwards, yes, you'll feel better for a few minutes, but the long-lasting effects you're missing out on. Hey everyone, Dr. Todd from Gonstead Spine Wellness. In this video, we're going to talk about what do mobility tools really do. Things like neck trigger point tools, double lacrosse balls, J-canes, foam rollers. A lot of people are familiar with foam rollers. Before we get rolling, make sure if you haven't already, subscribe to our channel, like this video, comment, share it with someone else, and let us know what else you want to see, and we'll make a video per your request, very likely. And keep in mind, we serve two audiences. One is our public here that wants to learn about natural health and healing, and our patients, our wonderful patients out here in Idaho. And the second audience is chiropractors. We teach chiropractors how to integrate their practice with corrective exercise and functional movement. That's called MoveNow University. There's the respective phone number and links below, so make sure you check that out, whether you are on the patient side or public side or the chiropractor side. Let's get into it. So let's get back to this. Now, in the mobility tool space, the exercise space, physical therapy, chiropractic, there's a lot of misinformation, we hear that word a lot lately, on what mobility tools really do. And I remember back when I first heard about these, or at least in my mind, what I was trying to conceptualize that they did before I learned the science of what they really do, I was told that they help break up scar tissue. And the fact of the matter is, to actually change tissue to that extent, we've talked about this in other videos before, it takes over 2,000 pounds per square inch of pressure to physically deform tissue to the extent that a lot of the mobility tool advocates are claiming that these tools provide. So it's impossible, it's not happening. You would have to almost kill someone to be able to do that. So I'm not saying that they don't work, because they certainly do work. They certainly do help reduce pain, improve mobility, so ability to move, and they're extremely helpful in the spinal and other bodily part injury rehabilitation process. So how do they really work? That's what I want to just talk about briefly in this video and set the record straight of what these things do. So first off, these tools are things that we use in our clinic with our patients, and this is something that's just evolved over the years. We found the best combination of things that work with different protocols for parts of the spine, different extremity joints. So what do we have? We have a neck trigger point tool. So it fits behind the neck. You can compress, and then you can bend and move and shift. I'm going to show you the tools first, and then I'll explain the mechanism of what they do. You have a double lacrosse ball, which you can use for parts of the spine, which is why this shape is so convenient, because the pokey part of the spine, called the spinous process, can fit right there in the groove. And you can put this on the spine, and you can do different movements of rolling it up and down the spine or going through movements as this compresses tissue. Again, we'll get back to talking about the mechanism. This is called a J-cane, has different handles and hooks. You can use this to pin and put pressure on tissue, and you can go through ranges of motion while you have that pressure applied. And then we have a foam roller, which a lot of people are familiar with a foam roller. These have gotten very popular over the years, where you can lay on top of this with your legs, with your back, on the side, on the arms, and essentially apply pressure and move, whether in a quicker, lighter fashion or more compression and slow. So foam roller. And then these are mobility bands. These aren't really mobility tools as far as like the compression stuff, but this is part of the equation. I'm going to explain this as I go through the mechanism of how this stuff works. So again, I'm certainly not saying that these tools do not have a place. I'm just saying that they don't break up scar tissue. They don't deform muscle. Okay, what do these tools do? We talked about what they don't do. What they do is you can pin tissue. Let me start with the neck one, the neck trigger point tool. These little knobs can provide very specific pinpoint pressure on muscles on the side of the neck. You can compress tissue and then you move, okay? By doing that, what exactly are you doing physiologically? You are pinning skin down. Underneath the skin, there's something called fascia. It's like a cheesecloth connective tissue. And then beneath that, there's layers of muscle. And in between the muscle, there's more layers of fascia. And tissue should glide and slide in a certain healthy fashion for you to have healthy mobility. When things start to go wrong in our body, those tissues no longer glide and slide like they should. There's a variety of reasons why that happens, but essentially this is one of the corrective solutions in getting things to move again. You can pin a tissue and then you can move, and you're forcing those layers to shear and to start to move again, okay? There's a really great video you can look up on YouTube. It's called The Fuzz. If you look this up, it's a guy in a cadaver lab going through cadaver dissection. He starts to pry the various layers of tissue apart, and he shows this stuff that he calls the fuzz in between. He compares it to why dogs and cats stretch in the morning. They're trying to break up the fuzz. And a lot of people don't do that. They just get out of bed, they do their thing, they're maybe stuck in a certain fashion, and they get ready and they go to work. They don't consistently break up the fuzz, which is this type of adhesions between layers of tissue that at first are very subtle, but over time things start to glue down further and further, and pretty soon, instead of those layers moving independently, they all move as a unit. These types of tools help you pin and shear and stretch one layer over the other. This one does it great in the neck. There's protocols to do even in the forearm or down in the calf. This I talked about in the spine. You can put this on areas like in the upper trapezius, and you can lean into a wall. You can do it laying on the ground. You can do this on the forearm. This is great for tennis elbow type stuff. I'll put a link above. We did lots of stuff just on tennis elbow, full videos just on that. This is great because you can get to hard to reach musculature on your back or different parts of the leg, buttock, and you can go through ranges of motion. You can use different points on here to pinpoint tissue so that you can pin and stretch and move. Foam roller, same thing. You roll back and forth over this. And last thing I'll mention, I know I'm talking a lot about pinning and moving, but there's also something called ischemic compression. And that's where in muscle tissue, if you have what's called a trigger point, which is like a little knot, and that's a little area of dysfunctional muscle tissue, right? And there is a procedure or a technique called ischemic compression. Ischemia means a decrease in oxygen. A decrease in blood supply really is what then reduces the oxygen. And if you can compress a tissue and you can just hold pressure on that little taut and tender fiber, that little trigger point, that little balled up area on the muscle. And then essentially what it does is it starves that area out of blood supply and of oxygen, and it forces it to release as a response to that process. It's called ischemic compression, okay? So that's a process that doesn't involve movement, but involves just compressing. All of these tools also do that as well. And then the bands, and the reason that the bands are so important, and the reason I'm going to mention this in this video where we're talking about what mobility tools really do, is because if you want to really reap the benefits of this process of digging in muscles, going through ranges of motion, loosening stuff up, you have to end that session with some sort of loaded range of motion. Mobility bands can provide that. So something that we go through in our clinic is we have a very structured sequence of events that we teach a patient to do in order to fix these problems. First, they do global mobility. So let's say back to the neck scenario. The neck is restricted, it's not moving very well. Global mobility, the first thing we do some foam rolling stuff in the upper back, maybe even the lower neck, patients laying on the ground. That's global, okay? Then we're gonna do pinpoint mobility and pinpoint trigger point work. So then we're going to use like neck trigger point tool. We're going to bend and we're going to stretch. We use a double lacrosse ball. Then after that level, what we're going to do is then what's called extensibility. Then we're going to go through some stretching. Now that we've desensitized some of the tissues, and that's another piece that these things do, is that funny enough, if something's hurting and you put some pressure on it and you move around, you actually tone down that pain signal to the brain. So it desensitizes the tissue. It now possibly allows you to move into a range of motion that you weren't comfortably able to move into before. So back to what we're doing. So then you go through extensibility, which is stretching because you've desensitized the tissue. So then from that point, what you want to do is then actually perform the things that are going to make this last. That means addressing brain function, which is called motor control. And then you load the movement to also affect brain, but to repattern this whole proper movement into your body overall. So those last two pieces, that's something that would involve the bands here. Let's say we went through all of this stuff to get mobility of the neck. Let's say I go through some stretching. Now, the next thing after that, I'll grab one of these bands that's not all unwrapped. Then after that, something that you'd want to do is then you would want to do some motor control work. So you can take this band and I can pull this across my body, back and down. And by doing this, I'm contracting the muscles in my mid back. I'm depressing my scapula or my shoulder blades. I'm holding my shoulders nice and stable. And then I'm going to remind myself to relax my neck that I just worked on with all these mobility tools. And I'm going to rotate my neck side to side. This is a little more effective doing this laying face up on the ground, because sitting like this is actually more advanced because I have gravity acting upon my spine. But if I do this without gravity and I go through this range of motion, this addresses a motor control pattern. This helps teach my brain that while my shoulders are engaged and contracting, my neck can be nice and loose and relaxed. Why is that important? Well, because every time you go in and reach for something, if you don't have that neurological disconnect like we should, every time you reach for something, you contract the muscles in your neck over and over and over again, thus increasing the tightness of the neck, thus decreasing proper function, increasing pain. That is a motor control component of this. The last part of this, of why we have the bands, is because then what you'd want to do is some sort of loaded, almost like a fitness exercise, so to speak. So a strength movement, a full body movement. Ideally, I would do this standing up. I'll just stand up for this and show you. Okay, so now that I'm standing up, I have this band under my foot. I'm gonna do a shoulder press. So I'm standing, I'm rooted into the ground, I have my feet tight into the ground, I'm externally rotating with my feet, I'm contracting my glutes, so the muscles back here, I'm pulling my kneecaps up, I'm contracting my quadriceps, a lot of stuff going on. I'm tightening this hand over here, and I'm getting my neck nice and loose, and I'm gonna press overhead, straight overhead, okay? And then I'm gonna come right back down. As I come back down, I'm not just gonna allow gravity to pull me down, but I'm acting as though I have a cable that I'm pulling from the ceiling. So I'm pressing up, and I'm gonna pull back down. This is now a functional movement that involves musculature that attaches into the neck, shoulder girdle, and that's what rounds this out. You can even do some rotation while you're in this position, okay? So that's where mobility tools by themselves not only do not break up scar tissue like so many people talk about, but they are very temporary if used by themselves. If you just use these tools and you dig around for 5 or 10 minutes and you do nothing else afterwards, yes, you'll feel better for a few minutes, but the long-lasting effects you're missing out on if you complete the loop, something we talk about with our patients all the time, complete the loop and finish up that motor control component and then the loading component, the full body movement loading component, you will get lasting results from this that will carry over for a true correction. Now, keep in mind, you have to know what's going on with the structure of the spine, which is what we do in our clinic. We take x-rays of our patients. If you have structural abnormalities like a loss of the cervical curve or too much thoracic curve or a scoliosis, those are all things that can be managed simultaneously with this. And that's something we talk about in our other videos about posture and curve correction. So make sure you check those out. This is it. That's my video on what mobility tools really do and what they don't do. I hope this was helpful. I know we went in more depth than maybe I initially planned when I started rolling. That's how this always works. Dr. Todd from Gonstead Spine Wellness. When it comes to the health of you and your family, results matter most.